Hey guys, welcome and welcome back to my YouTube channel. So guys, if you've not subscribed, kindly subscribe. And today we are going to talk about penis cancer, or cancer of the penis, or what we call perineal cancer. So what is this? What is it? We are going to define it. We are going to look at types, and we are going to say some of the signs and symptoms. How can you tell you have a cancer of the penis? So uh, first, let's define. Perineal cancer develops when malignant cells in your penis grow out of control. Your penis is a rod-shaped reproductive organ that allow you to urinate and have sex. So it means, okay, the main parts include the rod-like that is shaft that extend from your lower belly to the tip of your penis, called the head or glans. If you are uncircumcised, a layer of skin called the foreskin cover the head. If you are not circumcised, the head of the penis is exposed. Cancer can form anywhere in your penis, but it is most commonly start on the head or on the foreskin. So, what are the different types of cancer of the penis? 95% of penis cancer are squamous cell carcinoma. This type of cancer form in the top part of your skin layer called the epithelium. Other less common type of perineal cancer form in different types, and we have the basal cell carcinoma, cancer that begin in the bottom layer of your epithelial. And then we have melanoma. This cancer develop or begin in the cells that control how dark or light your skin is, and this is called melanocytes. Melanoma is more aggressive form of cancer. Alafu we have sarcoma, cancer develop this is a cancer that develop in the muscle or connective tissue. It is an extremely rare form of a penis. So the next thing that we are going to look at is how common is it? How common is this penis cancer or cancer of the penis? Here's it. Perineal cancer is rare in the United States, accounting of less than 1% of the cancer among people with penis. However, it is more common in other countries, and perineal cancer account for more than 10% of cancers among people assigned male at birth. So another thing that let's talk about: at what age does penis cancer usually occur? Cancer is most common diagnosed in people over 55 years and above, but people under 40 can also get it. The average of diagnosis is about 60 years and above. Now, what are the symptoms, or how can you know, or that if you experience these signs, you can tell that maybe you might have the cancer of the penis. So, what are some of the common symptoms of the perineal cancer? So I'm going to say that not all cancer causes changes you can see, but perineal cancer usually causes your penis to look different. So the skin on the penis may become discolored and you may notice a lump. So the common signs and symptoms that will appear are painless lump or sores that may sometimes bleed, swelling or irritation, especially in the head of the penis, and this sign we call it balanitis. We also have skin thickening or changes in the skin color, flat growth that look bluish or brownish, foul smell, fluid underneath of your foreskin, small or crusty burn, and a rash. Less serious conditions like infection and allergic reaction also cause these symptoms. Still don't we don't It is better to have your healthcare provider to look at these signs and symptoms if you experience them. So what are the causes? When pineal cancer, with a pineal cancer, a healthy cell in your skin changes to become a cancer cell. So cancer cells multiply out of control, forming a mass called a tumor. These cells can ground out healthy cells. Over time, cancer cell can spread to other parts of the body, damaging healthy tissue and organ. So who is at risk of getting this cancer or pineal cancer? The most significant risk of pineal cancer is age 60. We've said 60 years and above, and also phimosis. Phimosis is common in uncircumcised infant, but rare in uncircumcised adult. So it is a condition that causes your foreskin to become so tight that you can't retract it or pull it back to access the head of the penis. It is possible that phimosis lasting in your adulthood increase the risk of infection and inflammation beneath your foreskin, and both may increase the cancer of the penis. We have HPV, human papilloma virus. Many of the same high-risk strain of the human papilloma virus that causes cancer have been found in people with pineal cancer. So the HPV associated with cervical and pineal cancer is sexually transmitted virus. Although HPV is present in nearly all instances of cervical cancer, it is present about half the time in people with penis cancer. So still HPV is a significant risk of pineal cancer. HIV, because of low immunity, pineal cancer is more common in people with HIV. Researchers are not sure why, but I think because of low immunity, your body cannot fight against infection and the viruses. When you have HIV, obviously your immunity is low. Also, tobacco use, alcohol use, those are people who are at risk of getting it. Poor hygiene is a common one. If you have cancer in other parts, is also another common risk factor. How will you diagnose pineal cancer? You will do physical exam and history taking, biopsy to confirm, and imaging, that is CT scan, MRI, ultrasound, and X-ray. What are the stages of pineal cancer? Imaging help healthcare providers to stage your cancer. So cancer staging allows them to classify how serious is the cancer, and it is based on the size of the tumor and how it has spread onto your body. So we have T, we have N, we have M. If we talk about T, this is how we call it, TNM. Pineal cancer is staged using the TNM staging system. So T stands from tumor, and T provides information about about your tumor, including whether the cancer cells have formed a tumor, and if so, how much it's grown to your penis. And then N, the lymph nodes. N provide information about whether the cancer has spread to your lymph nodes. If it has, your healthcare provider can note which lymph nodes are affected. Metastasis M, or that is M provide information about whether the cancer has spread to other organs in your body. If it has, your healthcare provider can note which organs are affected. So numbers following the letters TNM provide additional information about the tumor, lymph nodes affected, and whether the cancer has metastasized. So the number ranges from 0 to 4 or 1 to 4, with 1 meaning less cancer spread and 4 meanings the most spread one. Okay, management is just how other cancers are being managed, where medications will be used. If you're not circumcised, you will be circumcised. You'll do chemotherapy, we'll do surgery, radiotherapy, which therapy again? Immunotherapy, hormonal therapy, and others. Prevention is about weight management, getting circumcised, getting treated for phimosis, get the HIV vaccines, but that one is not in Kenya. Practice safe sex, that is use of condom, don't use tobacco and alcohol, practice good hygiene, and have one partner. So I'm going to stop from there, and that is it. Let's meet in the next video.